Hi everybody! Today I'm gonna talk to you about a tooth or dental abscess. A tooth or a dental abscess is a localized collection of pus, blood and liquid, like water, caused by the infection of a tooth and therefore the inflammation of its surrounding tissues. You will notice that an abscess has appeared because you will see a swelling or a bubble or a lump right on top of the gum that covers the root of the affected tooth. That swelling lump or bubble may have a white head, sometimes a red head, or sometimes without head and just the swelling. So depending on the stage of the evolution of the abscess, you may see different things. And sometimes it's painful and sometimes it's not. If that infection starts to spread, this will probably cause facial swelling, so you will feel the side of your face where the abscess is swelled up. Sometimes the skin gets red and warm. It can affect your eye closure, and if it's painful, that pain can be radiated to your ear or to your upper or lower jaw. The source of that infection can come from different reasons. It can be due to a cavity that has affected the nerve, so the nerve died, it starts to get rotten, and the infection comes from the end of the root, causing infection around the tissues. This is one reason. Another reason is if the tooth has no cavity, has no decay, it can be because of bone loss, so the bacteria find micro gaps around the roots and the bone and the gum and causes that pockets of infection. Depending on the reason of the infection, the treatment will be different. That's why it's only the dentist who is able to treat effectively an abscess. But in the meantime that you cannot see your dentist and decide if the tooth can be saved or it needs to be extracted, depending on how big the infection is, there's different things that you can do at home in order to relieve the pain, reduce the inflammation, and so get the swelling down. I'm gonna explain to you a kind of mix of conventional and natural remedies, and you take the one that resonates with you, okay? In order to release the pressure of that liquids around that tooth, you can try and see if it's possible to drain the abscess out by yourself, right? What you need to do, if that abscess has a white head, the drainage will happen through that white head. So what you need to do is to stretch your lip a little bit away and then do a kind of massage with your finger around that puffy area. So imagine that the abscess is on a front one, like this one or any of these ones, right? So you need to try to stretch your lip out like away like this, yeah? And then with your finger, after washing your hands, of course, try to press the area from the back forward, from the top down, and from the front backwards, right? Like this. Imagine that the abscess is here, yeah? So what you need to do is stretch away like this and press like that. Press like this and down, okay? Take a gauze or a swab or a cotton ball, dip it in salt water, and then after pressing, if any liquid come through with that gauze dipped in salt water, just clean it, yeah? And then again, press all the puffy area and try to see if you can release the pressure of the abscess. Then clean it with that cotton ball or swab dipped in salt water, even on baking soda with a pinch of salt and water, or with a little bit of any mouthwash that you can buy for gums that has chlorexidine on it, because the chlorexidine is the antiseptic that disinfect the area. If you wake up in the morning and you see that dental abscess, there's something natural that you can do, which is called oil pulling. There is another video done about oil pulling, so have a look on that, because there's many things that you need to know before doing it properly. So if you're keen on doing natural remedies, and this is something that you can do in the early morning when you wake up to get rid of the bacteria of your mouth. So depending on how big the infection is, the dentist will decide if it's necessary for you to take antibiotics or not. What you can start to do straight away when you wake up and you have pain, in order to release the pain and to reduce the inflammation, is to start to take ibuprofen, depending on your medical condition. If you don't have any problem about chest conditions and you don't take any other medication for anything, and for sure you will be suitable to take ibuprofen. So you need to take 2 tablets of 200 of ibuprofen in the morning, in the midday, and at night before going to bed. So it's 400 milligrams of ibuprofen every 8 hours per, I would say, 4 to 5 days. And then stop taking it. But I guess in this meantime, you would have seen your dentist already, and that dosage or another advice regarding analgesics, the dentist will give it to you. After trying to burst the abscess, as I have already explained, or if you're not keen on trying to do it and you just want to do something to keep the area as much clean as possible and something to reduce the inflammation and something to relieve the pain, what you should do is brush your teeth with a toothpaste that contains chlorexidine. Chlorexidine is an antiseptic, so it fights against microorganisms and it keeps the area cleaner regarding bacteria, rather than with your regular fluoride toothpaste. So brush your teeth with that toothpaste that contains chlorexidine, then rinse with water, get rid of the toothpaste, and floss in between your teeth, or use the interdental brushes, depending if the gap in between that tooth and the ones next to it is quite big, and you can use the interdental brushes instead of, or dental pick instead of the flossing. But when you do this, probably it will bleed. Don't worry, keep cleaning it, and then you will rinse your mouth with something that I'm gonna explain now. There are many different types of natural mouth rinses that you can use, and also the ones that you can buy in pharmacies or drugstores or supermarkets or whatever. The ones that I'm gonna recommend to you, or I'm gonna explain, is the ones that I have experience with. So I know that my patients over all these years have used them and it worked. For some of them, of course, and other have worked for others, right? Everybody's different. You know that not everything works to everybody, and everybody is different. So I'm gonna explain salt water mouth rinses, baking soda mouth rinse, hydrogen peroxide mouth rinse, and chlorexidine. Okay, the chlorexidine is the one that you can buy. The other ones you can prepare it at home by yourself. Right, the first one and the most common one is salt water rinses. You take a half cup of water, half teaspoon of salt, table salt, dissolve it, and then swish it around your mouth for about 1 to 2 minutes. You can do this 3 times a day, after each meal, I would say, and for about a week, I would say, but I guess you will see your dentist before that 7 days, so he or she will give you the advice about that mouthwash, and if you need to keep doing that or you need to change for another one. The second one is baking soda mouth rinses. Baking soda or bicarbonate of soda. You should do the same. In half cup of water, mix half teaspoon of baking soda and also a pinch of salt. Then dissolve it and swish that mixture around your mouth for about up to 5 minutes, but you just can do this twice a day. Both salt water and baking soda, they both neutralizes the acidity of the infection in your mouth, and they have also antibacterial properties. The third one is hydrogen peroxide 3%. It's a very good antiseptic, so it kills microorganisms and also is very good against a specific type of bacteria because it releases oxygen and it kills that kind of bacteria. It's the ones that normally causes the gum disease, but it's very good for bacteria that is causing that infection that the abscess has. You should mix equal parts of hydrogen peroxide and water, then swish that mixture around your mouth for about a few minutes, and then you can do this multiple times a day. Do not swallow it, otherwise it can irritate your throat. And just to add something, the hydrogen peroxide has other properties. It's very good to heal small cuts and wounds in your mouth. It's very good to diminish the mouth sores. If your tonsils are enlarged and they have growths on it and the plaque sometimes gets stuck and you have bad breath, if you gargle with that solution before going to bed, it will clean the tonsils and the bad breath may disappear. So it's very good for this as well, and it's very effective on avoiding the formation of plaque in your teeth, or to break that film of plaque that normally it can be built up in your teeth. Of course, it's not something that needs to be done instead of the brushing. You always need to brush your teeth first and then do the mouth rinse. The fourth mouthwash that you can use is the one that has chlorexidine. The ones that you can buy in a drugstore or in a pharmacy or in the supermarket. You will find that chlorexidine, that compound, in the mouthwashes that is for gum treatment, for gum disease. It's just important that it has 0.2% of chlorexidine. So what you should do is to rinse your mouth for about 30 to 60 seconds each time, and just twice a day. The only side effects that mouthwash has is that it may stain your teeth if you use it more than a week in a row every day. So I wouldn't recommend you to use more than a week. And then the other side effect is the alteration in taste. If that abscess is painful, like if you feel like throbbing pain, a pulsating pain, you can do a couple of things. One is to use clove oil and another one is to use natural garlic. Clove oil has eugenol. Eugenol is a compound that it has anti-inflammatory properties and pain relief. It acts as an anesthetic, like numbing gel, right? So what you can do is take a cotton ball and then use 2 to 4 drops on that cotton ball. Then place that cotton ball on top of the gum where the abscess is, leaving it in between the abscess and your internal lip. It can be on your in your front area or at the back here or anywhere. So in between your cheek or your internal lip and on top of the abscess, and just leave it for about, I would say, 2 to 5 minutes, and then remove that cotton ball, and that's it. But try not to swallow the liquid, right? Otherwise it can irritate your throat. And you can do this about 3 times a day. Another option for that throbbing pain is to use natural garlic. So take a clove of garlic, mash it with a pinch of salt, and then apply it on the area in the same way that I have explained with the cotton ball with clove oil, but this time will be the garlic and mashed itself. Then leave it for a few minutes, or as much as you can stand it actually, and you can do this for about 2 to 3 times a day. And there are also 2 more things that I would like to explain to you that you can do at different times during the day. which is to apply on the area tea bag, black tea or normal tea bags, and also chamomile tea bag. For the black tea or normal tea, the thing is that it has tannins. The black tea has more tannins than the normal tea, but both can help. So the tannins is a chemical compound that has anti-inflammatory and antibacterial properties. So at different times during the day, you can do a cup of tea, let it cool it down, put it on the fridge, right? And when it's cold, take the tea bag itself and apply as a compress or as a gauze or as a swab in between your on top of the abscess, in between your lip and the abscess, or your cheek and the abscess, depending where the abscess is, and leave it for a few minutes. I would say about 5 to 15 if you can stand it, and you can do this about 3 times a day as well, right? In the same way, the chamomile tea has anti-inflammatory properties, so it's also good to reduce the inflammation. So you do the same, do a cup of chamomile tea, let it cool it down, and then take the bag itself and apply it in the same way that I have explained with the tea bag. If your tooth is sensitive to cold, don't put it on the fridge, just leave it in room temperature. And also, if the inflammation affects your eye, so your eye is like kind of more closed than the other one, you can use that chamomile tea bag, cool down with your eye closed, apply the chamomile tea bag over your eye, just keep it for about 5 to 15 minutes and do this at the different times during the day. Right, I hope you enjoyed that video. There's many information on that one. Take the one that it resonates with you, or try a bit of all of them at different times and see which one works better for you. If you think that video will help your friends and families, please share it with them, and give me a like if you like the video, and subscribe to my channel so you will receive notifications as soon as I post a new video. Thank you very much for watching, and I'll see you in the next video. Bye bye.